Hi there, guys. So, welcome to JPWC 24 channel. We are here to talk with Serena today about her journey with chronic illness and mental health. Thank you for joining us, Serena.
It's my pleasure. Thank you for having me.
So, why don't we start with your story and what you've been through?
Yeah, so I have dealt with a lot just in the realm of mental health and chronic illness. I have some rare conditions I deal with, as well as some major mental health conditions. So I have been diagnosed with chronic PTSD. For some people, this is known as complex PTSD or CPTSD, as well as schizoaffective disorder. So I have, as far as mental health goes, I deal with those things. Now, when it comes to chronic illness, there's a lot more. So I have the condition called trigeminal neuralgia, as well as CRPS, also known as RSD, and CRPS stands for Complex Regional Pain Syndrome. Uh, these two illnesses that I just mentioned are known as the most painful on the McGill Pain Index. So I deal with quite a bit.
Mhm, mhm.
Yeah. Um, I'm also beginning to suspect I may have chronic fatigue syndrome as well. I am often very tired. Uh, obviously, complex pain can cause a lot of exhaustion, but I think there's another factor to it, possibly from the COVID virus.
Yeah. Okay. Yeah, I think COVID possibly had a lot of effect when it came to chronic illness, and definitely
Hmm.
mental health as well. Okay. So thank you for being so honest with us. So, why don't you explain a bit more about your CPTSD?
Well, chronic PTSD or CPTSD is post-traumatic stress disorder caused by multiple traumatic events. It can be debilitating, and honestly, I sometimes have panic attacks. I struggle because of it. It can be a lot to deal with just based on past events.
I see. And when did it start, and what do you think caused it?
Um, I would say this started for me when I was probably about 12 years old. Um, there were some really tough family dynamics going on, some abusive dynamics, unfortunately. You know, I I have just been through a lot with I would say my family more so than anyone else. My parents made some mistakes when I was younger, get into it too much, but they had had some problems in their childhood. I know this. And I know that sometimes generational trauma can manifest and continue down the line. So,
Yeah, I think especially with maybe the older generations that didn't necessarily deal with mental health and trauma as well as we are getting to. Um, I think where you don't deal with it, it just becomes a chain of events and a vicious cycle, and you end up doing the same things that you probably promised that you'd never do to your kids. Um,
yeah.
yeah, no, of course. And with your chronic illnesses, have they been going on as long or?
No. So, it the illnesses I mentioned, they didn't really start until I was about 26 years old. So that was something that happened after the pandemic had started. I can remember having to go to the ER for my facial pain, the trigeminal neuralgia. It was so bad. I could not function. I was bedridden for a while because of it. And another problem was the lack of access to health care. I could not get any health insurance for a long time. It was really a big struggle. And the CRPS started probably about 2 or 3 months after the trigeminal neuralgia started showing up. I mean, I just have a lot of nerve issues. It was just very unexpected.
Yeah, I can imagine. And at the time, what were the first symptoms that sort of manifested that made you want to seek help?
Right. So I can remember this was I had only been 26 for a couple of weeks, and I started like one night I woke up, and I had the worst pain in my face. I mean, this was the worst pain I'd ever felt. It was shocking, stabbing, like in my jaw, it was in my teeth, it was in my behind
Mm.
my eyes. Yeah, it was horrifying. And I just I had to go to the ER because I knew something really bad was wrong with me, and the pain wouldn't let up. It seemed to just be really aggressive, uh, you know eh, and as far as the CRPS goes, this was 2 or 3 months later. I had had a fracture wound when I was a young girl, but it seems like the onset was almost delayed for CRPS. I didn't start having, like, I started having around the fracture wound site. I started having like just intense pain in my feet, but it actually translated to both of my feet is the interesting thing. And I'd always had foot problems, but it just kind of seemed like I started having burning and swelling and just painful to the touch. I mean, it was just, all of this was really, like I said, it was unexpected, and
Mhm.
it really definitely changed my life.
So it wasn't even a slow build up. It was a bam, it's there.
Right.
And you had no warnings or anything. That's
Mm-mm.
crazy. Um, do they know what causes it?
Well, so um trigeminal neuralgia. So what causes the facial pain, the intense facial pain is they think, most of the time it's a compressed nerve like in just around the brain that like it's on the trigeminal branch. So obviously trigeminal neuralgia, there's a trigeminal nerve in your face, right? And there's a pinched nerve which is compressed usually by a blood vessel, and sometimes you can have multiple compressions. And they often don't know like why it really happens. And there are some cases where there is no compression and the person there's no surgery that can fix it or anything. It's just medication, medication is used to treat it. And um, yeah, it's definitely a very invasive surgery if you do have it for trigeminal neuralgia, but um, it's just a very weird disease to have. And what's weird to me is that all this started around the same time. I don't really know why this all happened, and like I said, COVID could have been a culprit. Who knows, right? And I don't know. That's what I think. And as far as the CRPS goes, what causes CRPS is misfiring of neurons, like in the brain, to the injury site, and it causes pain that's disproportionate, like intense, horrifying pain.
Mhm.
And that's really the cause of those two conditions.
Okay. So you mentioned before that surgery obviously can sort out the nerve, but does that fix the problem completely? Do you go back to normal? Is this a fixable thing?
It's fixable for some people. That's the weird part. Some people can have what is called MVD surgery, which is microvascular decompression. And for some people it fixes it, for some people it just doesn't.
Yikes. And for yourself, has that been something that's been treatable or not?
Well, I'm getting a brain MRI soon to see if I have a compression and if I'm a candidate for the surgery. So that's obviously going to be a very I'm very nervous about it.
Mm.
But it's something I may pursue is the surgery because I really need some relief, and
Mhm.
because I've had this for almost 4 years and it's just been a terrible experience.
I was just about to say the fact that you've had it for so long, but you're still basically at the start of the journey because they haven't like even realized that whether you've got a compressed nerve or not. Like, I
Yeah.
mean, I don't know how the American healthcare works or how good it is or anything because obviously over here in the UK we have the NHS, which it can be up and down, but you don't pay for it, so you don't complain as much as you probably would. But obviously, everything is costing in the States, so you kind of would expect a better level of care. Um,
Hmm.
which clearly isn't the case. It just seems to be that whether it's free or you pay for it, it's the same, uh, which is a shame to hear. Um, but yeah, it's crazy to think that you're still on that journey 4 years on. I mean, this has got to have had a massive effect on your mental health for the last 4 years.
Absolutely.
Um, and you mentioned as well about the fact that you have schizoaffective I can't even speak today. Schizoaffective bipolar disorder. Could you tell us
Uh-huh.
a bit more about that?
Yeah. So, schizoaffective disorder is kind of a subset of bipolar and schizophrenia. So, basically, it's a combination. Schizoaffective disorder is like, so how do I explain this? It's like, yes, you have kind of a touch of schizophrenia, you have bipolar disorder, but you have to deal with symptoms of both. However, I would argue that schizoaffective disorder is not quite as severe in some ways as schizophrenia by itself. And the reason I say that is in the way that treatment goes with schizoaffective disorder. So, someone, for example, who has schizophrenia, they might take their meds, but they're still going to have episodes. They're still going to struggle. Whereas normally, I would say a lot of the time, someone who has like schizoaffective disorder, they will take their meds for psychosis or some, or similar symptoms, and uh, it will work better for them. They won't like go into so many like cycles where they're just cycling in and out of psychosis quite as much. From my experience and my research, that's what I have learned about schizoaffective disorder. And of course, there is the component of bipolar disorder where you have mood swings, mood episodes. Um, it's not easy to deal with, but I will say that medication has absolutely saved my life.
Yeah. Mm, okay, that's quite interesting to hear because I mean you hear about schizophrenia and bipolar separately all the time, but never the
Hmm.
fact that there is one that is basically them gelled together,
Yeah.
which is quite interesting. And with the going back to a little bit to about the chronic illnesses, so with the chronic illnesses and the fact that you have been dealing with it for 4 years, how does that have an effect on your PTSD, your bipolar, and your mental health in general?
I mean, honestly, it's been really hard. I mean, yeah, it's definitely had an effect on my mental health, on everything. Um, I have medical trauma due to my chronic illness, which has led to more PTSD, unfortunately. Because I already had PTSD, but after my medical trauma, I'll share this. My PTSD score, if I can speak, PTSD score was about 6 times the average.
Yikes.
Yeah, yeah.
Yeah.
So I will say, you were talking about the healthcare system in the US. It's not always the best. And that definitely, my chronic illnesses have been troublesome to deal with. And I will, also say like they've caused a lot of problems. Yeah. I've felt a lot of just fear, anxiety, anger because I couldn't get the care that I needed. And another thing to add and to acknowledge is that CRPS and trigeminal neuralgia are rare conditions. And when you have rare conditions, going through the healthcare system, I think in any country can be challenging.
Oh, 100%. Yeah, because nobody has a clue what they're doing.
Exactly.
Because it's all very new to them. They're still trying to work the basics out.
Hmm.
Um, yeah, I can't imagine that must be impossible to deal with. And the frustration behind it as well, because you know what's wrong with you. It's just you've got to wait for the doctors to catch up, sort of thing, and put the dot the i's and cross the t's, and put a name on it, and obviously treatment.
Yeah.
Okay, so what is it like day to day with these conditions, chronic and mental?
Um, I'll kind of go through each of my conditions. With trigeminal neuralgia, um it's rough. I mean, obviously they're all going to be difficult to deal with, but like it's when I'm like chewing or talking, sometimes I'll get that jolt or that stab like in my tooth or in my face. And it's, yeah, it's, I've been told I'm very interesting because, I have this combination of these conditions. Like it's obviously something's going on up here, but, um, yeah, but got to joke about it, um, a little
You've
bit,
got to put
but,
the light side of it on me, otherwise you cry about it, basically.
yeah, I gotta have some humor about it. I'm obviously a little different the way I'm wired in my head, but it's always what I tell people. But the trigeminal neuralgia is very debilitating sometimes. When I have attacks, like really bad attacks, I have to go to the ER and they have to give me IV meds. It's in my arm just to calm it down. And that's obviously, gonna rack up bills, gonna rack up. So that's one thing I deal with. And then of course, there's the CRPS. I have gone all over the US to try and find like a treatment that would work for this condition. Gone all over the place, states away. We've traveled, and when I say we, my father and I, and um the pain is just terrible. Like I don't walk correctly sometimes. It's so bad. And um it just seems like we've been to dead end after dead end. And, I'm still trying to find something that will work for me. And, um, I mean, I appreciate the specialists I've talked to and seen, but it just seems like my case is very stubborn. Just haven't had a lot of success. Um, so that's my CRPS, very also debilitating. And then on top of that, yes, I've got my mental health conditions. I've uh, got my chronic PTSD, which, I relive moments of trauma in my head every day, and that's not easy. I deal with panic attacks when I am dealing with a difficult situation. That's not easy. And then, um, we move on to the schizoaffective disorder. That honestly has been the least challenging since I've been on the correct meds, just because the meds have kept me stable. They've kept me from going into mania or psychosis. So really, it's not been a huge problem. I think the main component that's been an issue has maybe been the way like I react to things or handle things. Sometimes I can um, get a bit of anxiety along with it, and it causes me to kind of be a little paranoid, maybe more paranoid than some people would be in some instances. And yeah, that's how I would describe it all. It's a lot to go through, but that's kind of how everything affects me. It's not a good combination, but I've learned to deal with it in my own way. So,
Well, yeah, it sounds incredibly tough.
mhm.
And I think you have to be pretty tough to be fighting on for it and still, obviously, as you say, make seeing the humor in it too. I think there's a lot of people that would probably crumble in your position, but you're still here, you're still fighting, you're still continuing to try on, and that I think that's very inspirational to everyone, to be honest. Um, so you should be proud of that.
Thank you.
Um, so with your mental health stuff, so the PTSD would have come from a past trauma. And obviously the schizoaffective bipolar. When did you start to realize that you might have those? Like what triggered you to get diagnosed?
Oh man, so that's a story. So in 2021, I knew like I had been diagnosed with bipolar disorder, bipolar 1,
Okay.
but I don't think the schizoaffective component was quite clear to them yet. It became very clear because in the summer of 2021, I stopped taking my medications. And it was, yeah, and so it was not a good choice. It was not a wise decision. It almost ruined my life. I mean, it drove away friends. It drove away a potential boyfriend, and it was not a good time in my life. It was a very dark time. And then of course, while my mania was getting worse when I was off my meds, I developed everything else, my chronic illnesses. It was just one thing after another. I would say 2021 was the worst year of my life. And
Mm.
so obviously, since I was off my meds, I started having manic and psychotic symptoms. And, when I went to my sorry, can't talk, my psychiatrist, sorry, a little slip in the mouth there, psychiatrist, yeah, he diagnosed me with schizoaffective disorder pretty quickly because I mean, I'd had a pattern, throughout my life of, being off my meds and really bad things happening. And um, I will say that since all of that happened, I have been in recovery. I have been actually steadily on my meds, and I've told myself after nearly ruining my own life, I will never go off my medications ever again.
We love to hear that. I'm glad that you're in recovery, and it is really impressive that come through that. I think coming off any mental health medication or any medication in general without doctor's advice is never a good thing to do, and it
No.
is only going to end in tears. Um, yeah, that's just dangerous thing to do. So how has your support been during your recovery?
Um, So, I kind of figured out that after I lost those supposed friends and that supposed partner or potential partner, I kind of figured out that those people were never going to like be supportive of me anyway. I mean, if they were going to ditch me during a hard time, then what does that say about them in the future if they had stayed? I don't think it would have been good. So I kind of see it almost as like a blessing in a way. Like they left my life, but they weren't going to be supportive anyway, right? So I made new friends. I did reconnect with some old friends, and honestly, I've kind of rebuilt my friend circle. I've completely gotten some new connections in, and I've honestly, it's not so bad. I'm doing pretty well. My family's supportive. It's just been it's been better than it could have been. I will say that. And I've done the work obviously to foster those connections and nurture them and get them going and um but I do have a support system. I have pretty I have a fairly small one that's growing, but I do have one.
Well, I mean, two things you bring up there is about the friendships that they didn't last and they weren't there in the bad times. It's what's that saying? If you can't take me at my worst, you don't deserve me at my best. And I think that is totally true. But I think going on to what you said about the fact that your support circle is small, there's nothing wrong with that. My
Mm,
therapist is actually constantly going on at me because I want to have this massive group of friends. But it's about quality, not quantity at the end of the day.
mhm.
You can have a lot of very shitty friends. What's the point of that when you could have a small circle of good ones? It makes a
Right.
lot more sense. And I think that I have to keep reminding myself that as well. It can be quite difficult sometimes because I think we're built in from a young age in life, UK or US, whatever country you're in, that being popular is the good thing. Um, and unfortunately, that's not actually true because most of the popular people are probably hated by the people around them anyway.
Mm-hmm.
Um,
Yeah, I agree.
in terms of the mental health support, then, so how is it in the US? How do you find the mental health support systems?
Oh, um, so the mental health system is okay as long as you have the right insurance. See, that's the
Mm,
thing. If you can't afford insurance, and this goes for medical stuff too, then you're tough out of luck. Like, I mean, it's not a good system right now because I will say, like, um, there are self-pay options, but that can get really expensive too. And it's really just all about money, it seems like. Like, in the US, it's all about big pharma. It's about just, yeah. And I'm sure, I don't know if that's true in the UK. I'm sure it is, but, you know, um, it's, it's just really difficult. Like, I have found that the medical system is worse than the mental health care.
interesting.
Yeah, I think so.
Yeah, I think in the UK it is very much about big pharma and it is about the medication, but I think the UK we see less of it because we're not paying directly for it.
Mm-hmm.
But when you do go private, you do see it a bit more. But I think with the NHS protects us a lot from that. So like we have prescription systems. So if a doctor prescribes you a medication, you pay a set price. So we don't see the costs that are going on behind closed doors that the government's actually shoveling for us. And I guarantee that big pharma, as you say, is probably cutting that knife pretty deep, given that it's government money as well, and they know that they can
Mm-hmm.
afford it. But
Yeah.
yeah, I think it's the same here in a way. I think that you do see it in a bit with the GPs and doctors here, in the sense that when you go to them with mental health, the first thing they want to do is get you on a medication. And now getting you on a medication probably gets the money in their pockets. So yeah,
Mm-hmm.
I think that's where you do see it. We won't necessarily see the cost, but you see little things here and there that will indicate that
Yeah.
we are going down that hole. Yes, but hopefully we will not have the situation where we have to fully pay for everything and the insurance and stuff, because I think that will the NHS is something that the UK needs to be proud of and needs to keep. Like it's such a good system.
Mm-hmm.
But in talking about that, don't want to go too much into specifics, but so with like the medication and stuff you take, on average, how much would you be spending a month?
Oh, medications alone, probably close to $200. I'm on a lot.
Wow.
200
Yeah.
US dollars.
Yeah, of
So,
course. But yeah, I don't even think anyone in the UK could fathom that how good we have it. The fact we can get it for, I think it's prescription could be like a tenner. Um, now I think it might have gone up to 12, but that's nothing compared to paying £200 a month. That's
yeah,
ridiculous.
yeah, and I will say it just seems like a lot of people in the US say the system is broken. I've heard a lot of people say that, especially disabled people, especially people dealing with a lot of problems, and not being able to get the access they need. It's a problem here.
Yeah, and I think it scares me as well to think of the medical professionals that have to turn down health care and life-saving treatments
Hmm.
because this person doesn't have the insurance. It's insane. I mean, we see it on US dramas all the time, but like where they use Sergeant Doe's name or something to slip them through the system, like they did on Scrubs or uh, Grey's Anatomy or something like that. But
Hmm.
you guys actually live in that world is just insane for us. And to think we're supposed to be such a connected system, but the US and the UK, but we do things so differently. It's
Hmm.
crazy. Um, so you mentioned obviously that you are in recovery, um, and I thank God that you can get your medications and you can be on in the good side of things. How would you compare your situation right now to when it first started?
Um, things aren't great.
Mhm.
Um, I'd say like right before it started, my life was actually okay. And then when it started, of course, things got really bad. And my life still isn't quite to that point before everything started. It's just a journey. Uh I would say it's better. It's better. But there's still issues. The fact that getting the right care has taken me so long is, I think, ridiculous. And because I know people who were in my area even who have been diagnosed with trigeminal neuralgia in a week. It took them 2.5 years to diagnose me. But part of that was because I didn't have health insurance. I couldn't get it. And see that, talking like about health insurance in the US, that's the big thing. That's the problem because we have this system where you have to buy it on the marketplace and
Mm.
can't afford it. You
You're out of
just
luck.
yeah, you have to go to these low income clinics and things like that, and it's not great. I did that
Yeah.
for almost 2 years. I went to this low income clinic, and No, they wouldn't even they wouldn't help me at all. It was terrible. And but to answer your original question, yes, things are better. Things are slowly getting better, but it's a very, very slow process, it seems like.
Yeah, yeah. And you mentioned as well, obviously we've talked about the bills and the insurance and stuff.
Hmm.
Not to get too personal, but are you
Hmm.
working at the moment? How do you manage to like support yourself with the situation
Ooh,
you
well, I am in a position where I'm very fortunate.
have? Mhm.
So my father, I live with my father.
Okay.
We're barely making ends meet, but he works, he's doing all he can do. He has to support me right now. And I'm in the process of applying for disability, right? So that's been something that's been horrible. So they have denied me 5 times in the US.
Yikes.
Yeah. Yeah, and they're still being difficult with me. So I've gone through attorneys. I'm trying to fight. And that's another problem that we could get into maybe, but it's just, this Social Security disability is terrible here, and they don't want to
Yeah.
approve anybody, but especially younger people.
Mm, yeah, I think there's almost which was going to be about my next question is what is the current perspective on mental health in the US? But I think with the young people, I think it's the same everywhere. They boil it down to laziness and that you don't want to work, when actually majority of us or majority of you guys that can't work do want to work. Um,
Oh, yeah. Like I really wish I could. I wish I could have a normal life.
yeah,
But I want that. But it's like, hey, I'm sick. Like I'm legitimately going through this and no, I'm not this isn't an exaggeration. Like, no, I'm not trying to just not work. Like I can't. Like it's not something I'm just trying to, do for whatever. Like, no.
yeah. I think the thing that gets forgotten is that you might not be working, which means yes, you have a lot of free time, but you're not well enough to enjoy it.
Mm-mm.
Um,
No.
it's not like you're going out there partying on your on your days that you're not working. It's that you're in pain. You physically can't do it.
I'm in bed.
That too doesn't help. And I was just about to say as well with the well, you mentioned that you've had to go down the lawyer's route. That's more costs that you've got without having to work. Um, it's just yeah, it's an incredibly tough situation. Um, and yeah, I wouldn't wish it on anyone, and you do not deserve to have to go through it either, as you are such a lovely person.
Oh,
Um,
thank you.
but what would the current perspective of mental health in the US, is it good, or would you say they still need some work?
Oh, it needs a lot of work.
Uh,
Yeah. Uh, I think there's a lot of maybe I don't know if this is true, but there's other countries out there who look to the US as like this country where everything should be great, right? But no, it's not. It's not. It's yeah, there I could go into a lot, but there basically people aren't getting the help that they need, and it's an issue. And I really hope that maybe in the near future or somewhat near future, something can be done about some of this because, yeah, things could be a lot better. And I will say it's for the people who aren't privileged. It's for the people who are not, yeah. So it's those people. It's the ones who are struggling to make ends meet, which are a lot of people. There are a lot of people struggling with their income right now in the US. And inflation is a problem here. I could just go into it so much more, but I won't today. So,
and with you not to get too political or too divisive, and I think this question might bring you some hate, but would you say things have got worse with the healthcare system and mental health system since Trump got in charge?
ooh, that's a loaded question because it's like there was some, okay, so on the news the other day, there was a headline that said that President Trump was trying to reduce prescription medicine costs by 30 to 80%. So you look at
Okay.
that and it's like, well, People think maybe, I don't know. See, I am I'm not someone who's really into politics, but I will say that like it's mixed with him. Like I think, a lot of people think that he's doing some harm. He's firing a lot of people. He's cutting all these programs. But then there's other people who say, no, he's trying to make things better. He's trying to get rid of the imposters, the people who are not doing things like as they should be and all of this. But it's really just a mixed bag. It depends on who you listen to, what news outlet you go to. It's honestly a very confusing thing in the US right now as far as politics go. So it's hard for me to answer the question because I'm confused, honestly.
Yeah, I think I mean, for the rest of the world looking at America right now, I think it
Hmm.
is kind of we are looking at like what the hell is this madman doing? But at the same time, as you say, I think it is a double-edged sword. I think some people will see what he's doing as tearing away what you had because it clearly wasn't working and starting again. But some people will be like, oh, what the hell is this man actually doing? Is he crazy?
Right.
Um, and I do not to give him any credit because I'm not a fan, but I do think he's smarter than what he comes across as, and I think he knows exactly what he's doing, whether it's good or bad. So
Yeah.
yeah, anyway, we'll move away from the politics because obviously this is
No
not what it
worries.
is, and I think the mega gang are probably going to come for me after that last statement. But hey ho, any what what advice would you give to someone right now that um, that has just been diagnosed or is experiencing symptoms quite similar to yours?
Well, that's it's there's a lot to it, right? So I would tell them to keep going. Like I would just say like you never know what your future is going to be. Like you could be somewhere totally different 2 to 3 years from now, but you've got to keep going to find out. Like, I don't mean for that to sound kind of like ominous, but it's also it's like, well, you've got to keep going and you've got to give an effort for things to change at all, right? So I would just
Mhm.
tell people like try to find that strength, do the things you love, just rely on your support system and just do your best, whatever that looks like. It doesn't have to be perfect. You don't have to be perfect. And just do your best. It doesn't matter if that's barely doing anything every day, right? Like, yeah.
Okay. Yeah, no, that makes sense. And I think that, as you say, it sounds obvious when you say those sort of things, but sometimes the most obvious things isn't the things that you or I, who have been through mental health crises, have would actually be thinking at that time. And sometimes it's just someone else saying it to you that actually might get it through to you. Um, it's like telling yourself you're enough. It's really hard to do, but if someone else actually says it to you, you might actually listen. Um, because I am the
Yeah.
worst at listening to my own advice.
Mhm.
I will give the best advice to my friends, but when it comes to me actually taking it, not a chance in hell. Uh,
Well,
and
something else I would like to add though is that I think something I'd like to tell everybody is that like you should also care about people. You should care about other people and what they're going through. Like have that empathy and because I feel like once you start caring about something outside of yourself, something bigger than yourself, you find that purpose too.
yeah, yeah, I know, I agree. I think it stops it becoming all about yourself, and you stop wallowing in your own pain and suffering. And yeah, yeah, that's really important. I think you're completely right on that. And what advice would you give to the younger version of you?
I would tell little Serena that you're going to have to be strong, but that there will be good moments in the darkness. I would tell her to shine and be the light that other people need.
That's really sweet. That is really sweet. And is there anything else that you'd want to tell the world right now?
Um, like I said, like I don't know, mental health is important. I would like to tell the world that mental health is important. Like I said, you need to care about other people. Like, um, there's just so much like there's bad in the world, but there's good too, is what I'm trying to say. And um, yeah, that's kind of just the general gist of it. Like I be that light for other people. That's kind of my thing. So,
You know, I think that is really important. I think that we all need little lights out there at the moment because, as you say, the world is filled with so much hate at the moment.
mhm,
I know the US is really going through it with the whole transgender thing, and
mm,
Trump's uh, being in charge has made the world very divisive. You've got the stuff that's going on in the Middle East. You've got the stuff that's going on in Europe. Even the UK bringing down their judgment on transgender people, and things are definitely taking a turn for the worst over here too. So I think that the seeing the little positives and trying to make be that positive in someone else's life is so important right now. Um, yeah. And lastly, anything else you would like to add?
honestly, I would just like to say thank you for having me and thank you for allowing me to share my experience and kind of my day-to-day life. Um, hasn't been easy, but I'm gonna keep going.
No, and thank you for joining us. I mean, I think it's important to tell these stories, but I think it's even more important that we're not just getting the British side and that we think that it's all happening here. I think it's important to recognise the global that this is a global struggle with mental health, and it's not just the UK that is struggling to deal with it. And I think that also us Brits need to be a lot more thankful for what we've got, such as the NHS, as I say. Even though it doesn't always work all the time, it is still a godsend. Um, and I think it's a wake up for the US too is that get on board, get free healthcare. um, it's about time. But yeah, I mean, Canada can do it. You guys can do it too. But we'll see. But no, thank you so much for joining us and telling us your story. I mean, your story is so inspiring and so amazing to hear as well. And the fact that you can do it with a smile on your face still is is an inspiration. And you have shown true strength. And obviously, we've spoken over coming weeks. And I
Mhm.
can tell that you're a really lovely person. And I do hope that things get even more better for you.
Thank you so much.
No problem at all. Well, guys, thank you everybody for joining us today and listening to Serena's story. Please show her some love. She will be tagged in the video. And yeah, check out my other videos too and keep donating to my fundraiser. This has been JPWC 24. I hope you're having a great day and a great mental health day, and we'll speak to you soon.